Good morning, everyone. Welcome to Facebook Live Medicare Monday, Coffee and Conversation. I'm Susan with Indiana SHIP, the State Health Insurance Assistance Program, and I'm joined this morning by my co-hostess, Melanie Garland. Good morning, Melanie.
Good morning. Absolutely. Happy Monday, guys. And we've got a great presentation planned for you today. And we've been busy with open enrollment, but we've been keeping up with the changes and the updates that are going to happen next year. And so we wanted to kind of, before the year ends, kind of talk about the Inflation Reduction Act and how that affects some updates and changes with Medicare. Some are going to happen right away, starting in January, and then some are going to happen a little later. So Susan has created a wonderful PowerPoint for us this morning to go over all of those details and everything that we think that you need to know. So without further ado, I think we can dive right in. And as we go through things this morning, feel free to chat in any of your questions. And by chatting, I mean comment on this video, and we'll be monitoring those comments throughout today's presentation and even afterwards as well. So if you have a question or anything that pops up, send it to us and we'll try to answer it live, or we'll try to answer it afterwards too. And if you're watching and thinking, oh, I know someone that could benefit from this, or I want to tell so-and-so about this presentation, well, don't worry, we save all of these videos to our Facebook page for later viewing. So without further ado, Susan, it looks like you've got it up. So here we go.
All right. Thanks, Melanie. Okay, we're going to just start from the beginning here. There we go. All right. So as Melanie said, just feel free to chat in any questions you have, and we'll get those answered. Okay, so I did find two fabulous sources, and they're really good sources of information about Medicare in general. The Kaiser Family Foundation, KFF, is a very nonpartisan source of great information, research information, as well as Justice in Aging. So that's where the bulk of the information came from for this presentation this morning. All right, so let's start about how Part D, the drug part of Medicare, is impacted by the Inflation Reduction Act. So starting, in 2 weeks, the Inflation Reduction Act requires drug companies to pay a rebate back to the government if their prices for their medications increase faster than inflation does. And we all know that's certainly a moving target. Now, this has been going on with Medicaid for years, but the IRA is compelling folks who bill Medicare Part D to do that too. Another thing is in 2024, which will be here before we know it, it's going to limit annual premium increases for Part D plans. I know we now have in 2023 some really two different low-cost monthly premium plans, but I don't know about you, Melanie, but I did see quite a few jumps in prices for some of the other plans. One plan in particular went over $100 a month. So the government's going to control some of those annual premium increases. Also in 2024, it's going to eliminate the cost sharing in the catastrophic phase of Part D. So some people go into the coverage gap where they pay 25% of the cost of their medicine. And then once they reach a certain amount, several $1,000s more, they enter into catastrophic coverage. And that's where you pay 5% of the cost of your medications. And 5% doesn't sound like much, but when you're talking medications that are thousands of dollars per dosage or month, 5% of that is a lot. So they're going to get rid of that. And I know people who are on super high cost medication that's even coming through Part D are going to be relieved about that. Then if we look further into the future, 2025, the out-of-pocket OOP is out-of-pocket Part D costs are going to be capped at $2,000. And if you have to pay all of this in the first few months of the year, that can be very difficult. So they're going to create a way where you can spread out your maximum out-of-pocket of $2,000. Currently, there is no maximum out of pocket for Part D. So folks who take super expensive medicine, who are in the catastrophic phase paying 5%, there's no protection there. So this is terrific. Then even further in the future, 2026, it's going to phase in price negotiation. So currently there are third parties that enter into the negotiation process between Medicare and pharmaceutical companies, but it's going to allow and compel Medicare to deal directly with the pharmaceutical drug companies and deal and negotiate those prices for some high cost drugs. Melanie, and feel free to add in anything you want as we go through these slides.
Will do, absolutely. And when you were talking about the annual premium changes, I'm so happy to hear about that because, sometimes when we're meeting with individuals to check their plans for next year, especially during open enrollment, I may meet with someone that hasn't made a change in 10 plus years, and they think that it's just part of it, that it just kind of goes up like other insurance plans that they may have or have had in the past. And so I'm really interested to see how 2024 will kind of pan out with that. And I think just the more education, that we'll learn, I'm sure, over this next year, we'll be able to provide that more information. So yes.
Yes, absolutely. All righty. So let's talk about insulin. I think this is one of the things that the media and the Congress are really promoting about how the IRA is impacting Medicare beneficiaries, and that's the cost of insulin. So if you take insulin or you know of somebody who takes insulin, it can be hundreds, plural, of dollars per month, and that translates into thousands of dollars of cost for a truly life-saving drug. So a huge benefit to people with diabetes is capping that insulin cost to $35 a month. And this is effective January 1. So I know when Melanie and myself and all of our coworkers and our SHIP counselors all over the state were working with beneficiaries who were on insulin, we had to do some kind of gymnastics around the Medicare Plan Finder because it hasn't yet been updated, but it will be. And in case you are on insulin and the Plan Finder, the insurance companies have not triggered this $35 a month in the first 3 months of the year, your plan will have to reimburse you for any excess costs beyond $35 a month. So by March 31st, if not before, everything is going to be ready to roll. But just in case you're experiencing higher prices at the drugstore after January 1st, you will get that money back. So insulin is also used by the insulin pumps. Now this phase in for $35 a month for that kind of insulin happens July 1. But it's important to know that the actual pump and the supplies come under Part B of Medicare, and so they're not included in this $35 a month thing. Also not included are the many people with diabetes who take management drugs like Trulicity, Ozempic, and Victoza. Those are all very expensive medications, and sadly, since they're not insulin, they are not included in the $35 a month cap. Melanie, do you want to talk about vaccines?
Absolutely, yes. So this has been some great news to kind of share over the last couple months. But part of the Inflation Reduction Act, and this will go into effect January 1st of 2023, is vaccinations that are covered under Part D will not have a copay. So one of the biggest ones that we think of is the shingles vaccine. So it's usually a 2-shot vaccination process. And I've heard, I may not be completely accurate here, but I've heard it was like $250 or so, give or take a little bit per shot. So this was a really expensive preventative vaccination to take. And so now, since that's covered under the no copay for your Part D benefit, that'll be $0. And that also includes your pneumonia and flu shots as well. So I did kind of chuckle at this because my father just got his shingles shot within the last year, but my mom did not. So now she can take advantage of that 0 premium next year when she gets her shingles shot. So hopefully you didn't get your shingles shot within this last year and you can get it next year and have that $0 copay. But really excited about that, especially, with pneumonia and flu just being rampant right now. It's a really good thing to know that will be a $0 premium for you. So we're excited about that new update.
Right, I agree. And I know I've been telling my friends with who received Medicare, just wait till January 1st and then you can get in for your shingle shot for free. Because like your dad, a lot of my friends got their shingle shots already and they had to pay a couple $100 a month under their Part D plan. Also the COVID vaccines remain free. And another thing about COVID is that the free tests are now available again, right off that USPS, the United States Postal Service website. Super easy to get. You just put your address in and they'll mail you a couple of COVID tests for free. So don't buy those, get your free ones.
Absolutely, yes. And this time of year, it's safe practice just to have them on hand. So
absolutely. Okay, so let's talk about Extra Help. Extra Help is a program that's administered by the Social Security Administration, and it helps people with a little bit lesser income and fewer assets afford their prescription drugs. So this can be in the way of premium assistance, coverage gap assistance, and where the rubber hits the road really is when you go to the drugstore and you're not paying any more than around $10 for your medication. And many of them are free or as little as $4 and some change. So Extra Help is huge help for many, many people. And it's going to expand all of their income guidelines to 150% of poverty. So this is going to happen next year, 2024. I feel like it's 2023 right now. So that an example of that, if a person at 150% of poverty right now, it would be $20,385 a year for a single person. So anybody in those income guidelines do go up. So this will be it'll be a higher income limit in 2024. But if it were happening this year, this is kind of gives you an idea on if you may qualify. Now, there are asset guidelines as well, but those are, in the $15,000 range currently. And also currently there is full subsidy for Extra Help, and there's partial subsidy, which is kind of like a sliding scale. So if you make a little bit more, then you pay a little bit more. So I am thankful that in 2024, there's not going to be this partial subsidy, that if you qualify for Extra Help, you qualify for Extra Help and you get the assistance that's built into that program. So stay tuned for that. We're going to be really doing some push on our advertising. So all people who are eligible for Extra Help can get assistance signing up. And that's something that you can get from your SHIP counselor in your community, is help with Extra Help applications, or maybe just reviewing the program and seeing if it's something that might be helpful to you, as well as the other assistance programs. This is a chart that I kind of reworked and got rid of a bunch of other states, just to show you how many Hoosiers are impacted by this. So our first chart here is over 32,000 Hoosiers will be impacted by eliminating that 5% coinsurance above the Part D catastrophic threshold. That's, when you have to pay 5% of the cost of your medicine once you hit catastrophic coverage. 32,000 people are going to get relief from that. And in, I believe it's 2026 or 2025, when a $2,000 maximum annual out-of-pocket cap is effective, that's going to help almost 40,000 people. And for those folks who are on partial extra help, 6,000 of those will be experiencing full benefits when that change occurs. And then, of course, a huge number, almost 96,000 people, are going to be helped by getting their vaccines covered under Part D. Okay, Melanie, you want to wrap us up and give us our reminders?
Yes, absolutely. Those numbers are just kind of eye-opening, really. That's awesome. I'm so glad that these changes are going to help our Hoosiers. So, yes. So, if you need some further assistance, so the information that we provided today, about the Inflation Reduction Act, this is part of what we can continue to offer, in person, or our call center can provide information or provide a local SHIP counselor or SHIP site or enrollment center in your area that can assist you with some of these assistance programs and just Medicare questions and counseling in general. So to contact us, it's that 1-800-452-4800 number, and we'll put that in the comments as well. And then we also have a website, and our website has great general information, has a lot of our informational materials, different media promotions that we have. And then it also has a map of our sites and counselors throughout the state. So you can kind of contact us that way as well. And then if you're watching us, then you already follow us and like us on Facebook. But if you know someone else that may need to or would benefit from it, share our information with them. So we're on Facebook, Twitter, LinkedIn, and we also have a YouTube channel. So not only do we have these Facebook Live presentations on our Facebook page, but we have our Facebook Live presentations shared on our YouTube channel as well. So if you'd like to give us a follow, we'd appreciate it. And we hope to continue to provide informational materials and promotions and videos like this one throughout next year as well. So with that in mind, we will be taking off the holiday season with our Facebook Live. So we probably won't see you guys on Facebook Live for that matter until 2023. So we'll see you guys all next year, and we're excited and planning all of our Facebook Lives and promotions and videos for next year. And if you have any suggestions, go ahead and give us a comment on this video. Let us know what you'd like to hear, like to learn more about, anything like that. We learn our best from what our audience needs from you. So let us know, and we'd be happy to do what we can. So with that being said, we'll catch you guys next year, and we hope everyone stays warm this week and safe, and has a wonderful, wonderful holiday season, and Happy New Year.
Thank you.
We'll see you guys. Bye-bye.
Bye.